Next, we have Marcy Russo.
Good afternoon, Representative Wood, Senator Wong, Representative Pavlak, D'Amato, and members of the Insurance Committee. My name is Dr. Marcy Russo. I'm a licensed psychologist living and practicing in Connecticut, and I am currently the co-chair of the Connecticut Psychological Association's Legislative Committee. So not only do I speak to you today based upon the experience of my own clinical practice in Connecticut, but I also confidently represent the voices of all of our members at the Connecticut Psychological Association. And I am here to testify in support of House Bill 5377 and Senate Bill 341. So supporting these bills will really allow meaningful reform to Connecticut's insurance clawback laws. Insurers right now are allowed to demand repayment for previously reimbursed services, and this often arrives with unclear expectations, inadequate information, and at times, many, many months after delivering a service to a patient in some instances. Every healthcare provider in Connecticut is currently delivering services to patients that are in desperate need of clinical intervention. These clawbacks create financial instability for us providers, and they also, they create instability for us providers, and it brings clinicians often to leave insurance networks and at times, unfortunately, close their businesses, leaving patients without needed care. Also, there's an extreme amount of administrative burdens that clawbacks do place on providers, and we often are left in a place to chase insurers to help understand why monetary compensation is being taken back well after a service has been delivered to the patient and the claim paid by the insurer. And actually, for psychologists alone, I know Christian in his testimony gave this statistic to you, but together as a Connecticut Psychological Association, we've been able to determine that over 68% of us psychologists here in Connecticut have experienced a clawback, and some of them have been quite substantial for our members. So I'm here to tell you a little bit about House Bill 5377, Senate Bill 341, in terms of why you should be supporting these particular bills and their passage. 5377 offers the strongest procedural protections, including mandating electronic appeals and a 12-day business deadline for insurers to respond to audit appeals, and defaults in favor of the provider if the insurer misses such a submitted appeal. And also, Senate Bill 341 reduces the clawback window to 12 months, which is a 6-month different than what is currently in Connecticut. So reform, as I can say, is desperately needed to shorten this clawback window for us providers. It can strengthen notice and appeal protections. It can ensure that providers who deliver authorized care in good faith are not penalized for the errors that they did not cause themselves. So I respectfully urge the committee to pass these two bills. I know and I appreciate some of you that have had private conversations with us as an association, and I'm available today or whenever for questions regarding these two particular bills that are in front of your committee today. Thank you very much for your time, and I also submitted written testimony for you to view.
Thank you, Marcy. And we've been working with you for several years on the clawback issue. Appreciate your advice, knowledge, and all your work on helping us get to this point. And fingers crossed we can get something over the finish line this year. Senator Wong.
Thank you very much.